A new model for development. Now, what did you make of that?
Yeah, Eric Gooseby actually had a really exciting and interesting presentation yesterday in the WHO symposium. And he talked about the importance of collaboration and partnership among the major sectors, the major players in development, which include the community that provides accountability and sustainability. It includes the private sector because that provides efficiency. It includes academia because they provide rigor and research. And last but not least, inclusion of the government, because you can't actually sustain anything without collaboration with the government.
And the how of all of that?
Well, I think that's the big question, and it's sometimes very difficult actually to get all these main players to communicate with each other and collaborate. But I think in terms of the post-2015 goals, which is what everybody's talking about these days, I think it will be essential and critical for all of these sectors to work together.
Accelerated implementation, that's something else we've been hearing about.
Yeah, so Dr. Gooseby also addressed this as well, and he emphasized the importance of not conducting business as usual. So identifying high impact activities, identifying high impact solutions, and bringing those to scale. So don't waste your time doing the stuff that doesn't work. You really want to identify the stuff that works and scale that up. And
community-driven approaches?
Well, that is the theme of the conference, community-driven solutions for the next generation. And I think it is absolutely critical and imperative for TB elimination. The public health sector and the hospitals can't do it on their own. You really need to involve the community. And I think that as time goes on, that will be defined more clearly for different settings. But we need to have a patient-centered approach. We need to be thinking about the community in terms of supporting the patients as throughout their treatment.
And what have we learned in these last few sessions about the convergence of communicable diseases with non-communicable diseases?
I think this is definitely coming out as one of the main themes of the conference, as we saw in the press conference this morning and in some of the keynote speeches that we've seen as well. So of course the main non-communicable disease that's been highlighted is diabetes, and but we have other non-communically diseases, things like smoking-related lung disease, things like malnutrition, which we know increases the risk for TB, and elderly, which is actually not a disease, but it's basically just a state of being where your immune system weakens. So all of those things increase the risk.
And what needs to be done, very briefly, about those things?
I think it's raising awareness for physicians and public health professionals who may be caring for people in any of these risk groups. You just want to have it at the forefront of your mind that to be thinking about the communicable diseases, TB in particular, because in these risk groups, if you identify early and treat effectively, TB is curable. MDR-TB is also curable. Even XDR is curable, but we have to identify early and initiate treatment.